you have to have a conservator to open an ABLE account. And so that is the problem. There's no one person that is setting any kind of rules or policies or looking at the papers that come from a courthouse or from a judge that are filed, you know, signed by a judge and are official. They don't have anybody who's looking at the exact language that needs to be done. And so if that's, I think that's the biggest part of the problem. We don't have a go-to person that is setting down, here's what we need. And that same person isn't being asked the same question. Instead, it's being asked of different people.
Well, and I would have thought that they would have clarified that when they created the accounts, you know,
Nope.
the enabling legislation and rules that followed. You would have thought that they would have.
Well, I think it's because people think they understand what the statutes say and how orders are written. And I say people, non-lawyers, and then they ask lawyers to come in later and clean up things when they should have involved a lawyer prior in the beginning, and they didn't. So that's the problem.
Yeah, well, that's disappointing.
Yeah.
Hey, Greg. Hey, Dave.
Hello. I had to unmute.
How are you guys?
Doing good. Why don't you bring him in here, Winifred? Bring him in here and I'll put him on the screen. Oh, yeah. Okay, let's see how he's doing here. Oh, yeah. Put on the camera.
Yeah, I was going to say, Dave, you need to put on your camera. Oh.
Oh, there.
Oh.
There you go. That was the newest member of our family. He's 8 weeks old.
Oh.
I can see the resemblance.
So Carrie, how are we doing on the quorum? How many more do we need?
I think we need 2.
Okay. So maybe give it another minute or 2, you think?
Yeah.
We did hear from one of our new members that she was not going to be able to make it. She was on a plane. I don't know why she couldn't participate from, you know,
That's
a plane.
no excuse.
You can do business anywhere now. I wouldn't want to be the one sitting next to her if she was, though. I'll admit that. Oh, there's Kim. Good afternoon, Kim. Can you hear us okay, Kim?
Yes.
All right, we're gonna wait maybe one more minute. We need one more person for a quorum. Oh. I think we may have our quorum. Hello. So the Zoom account says Cody Sumner.
Oh.
Is it Kara?
It's Kara, sorry. We have his online school. Let me see if I can get this updated.
There you go. All right, Jim, I think we're good to go. We got our quorum.
We have a quorum? Okay, then we'll start. Well, welcome everyone. Welcome to this nice, bright, sunshiny Kansas spring day. And I don't know about the April showers and May flowers, but all mine froze, so I don't have any. But anyway, welcome everyone. And we have a new member, Kara, I believe. And would you like to introduce yourself and tell us just a little bit about yourself and why you're on the board?
Well, I am a part of Commissioner Howell's district. I live here in Derby. I am a mother of 4. My youngest, Cody, has a very rare genetic disorder called floating harbor syndrome. With that comes an intellectual developmental delay. And so until Cody's development started to show that there were issues, I had never really considered what our community needs, you know, to be inclusive. You don't really know much about being inclusive until you're in a situation where you see areas where inclusivity is lacking. I'm really happy to be here. I work part-time for the school district as a substitute. And since COVID, I've been home with Cody because he can't actually be in the classroom due to an immune issue with his disorder. So I'm just excited to be a part of it. Happy to help in any way I can.
Well, welcome. We're glad to have you. And I think, is that all our new members, Jeanette, this morning?
Looks like that's the only new one on, but maybe we want to introduce ourselves to Kara.
Okay. Okay. Well, I'll start since I'm here. I'm Jim Dinkle. I'm the chair, obviously, and well, soon to be not chair. And anyway, I have been on the board for quite some time, and I had a son that was developmentally disabled. He passed away a couple of years ago, and I still remained on the board. So I'm just happy to be a part of the board.
And I'm Jeanette Livingston. I'm the Assistant Director of the Sedgwick County Developmental Disability Organization. And you'll hear that referred to as the SCDDO. And stop us if we use an acronym you're not familiar with, Kara, because we're bad about that. So I'll try to say everything. One you might hear is Intellectual Developmental Disability, abbreviated as IDD. That's another one, but we're very glad to have you. Grace, I don't know if you'd like to go next.
That'll be fine. Grace Neal, and I have a developmentally delayed daughter. And I am also a retired teacher of the deaf, working with multiple handicapped deaf children. And I've been on the board several years. I don't remember exactly when I joined, but I'm still interested in, my children are all grown, but I'm still interested in what the community here has to offer.
I'm Greg Sullivan, and I had 2 special kiddos. Both of them are also deceased, but also had the experience of creating my own limited license agency and working with the marvelous people at our SCDDO to help make that all happen. Yes, made my kids' life much richer and better, and had the ability to surround my kids with many angels, and very grateful for this organization. Been on the board many years. I've been through, it feels like dozens of county commissioners, but currently Lacey Cruz is my representative.
Leah, you're kind of cutting in and out.
Sorry, I was trying to use the keyboard function, but I'm just going to take it off mute. I'm Leah Gagne. I've been a board member for a little over a year. I am also a parent of a special needs son who will be 29 this year. But I also am a lawyer here in Wichita, a solo practitioner, and I work a lot with families, especially doing guardianships, just helping families navigate the process of moving through being, having our kids at school into adult services, what they need to do, the next step, all the things that we as parents don't necessarily get told about and how to navigate. So I do a lot of working with families who have children with disabilities, both my husband and I, and we're active with Special Olympics as well.
Dave, you want to go next?
There, I'm having trouble getting it unmuted. I'm Dave Jones. I'm on the board of Cerebral Palsy Research Foundation, and I spent 39 years as the director of United Cerebral Palsy of Kansas. And I think I was originally appointed by Carolyn McGinn, so that goes back, what, almost 25, 30 years. Greg, how long does that go back?
I don't have that many fingers and toes, Dave, sorry.
Okay. Signing off.
Kim, would you like to introduce yourself?
I'm Kim Moore. This is the beginning of my 4th year being on the board, and I have a special needs niece.
Okay, and Peggy joined us late, but Peggy, we're introducing ourselves to Kara, who's our one of our new board members.
Hi, Kara. Sorry, I couldn't find the Zoom. I finally found it attached in all the emails. I'm on my 2nd term. I just got reappointed in this spring, and Pete Meitzner appointed me. I am the legal guardian since my husband passed of autistic young man. He's 40, and I take care of, he lives in a group home, but most of his needs, and he spends his holidays and vacations with us. And then I'm also the payee for 2 other special needs that have an intellectual disability, as well as BJ's payees. So I'm very interested. I have a passion to help. I'm the principal over the special needs here at Sunrise too. So thank you.
Awesome. Okay, Shelley, would you like to introduce yourself?
Absolutely. Hi, Kara. My name is Shelley Harrington. I am the Director of Quality Assurance at the CDDO. And so my role with this committee is to present information about our providers network. And it's actually something I'm going to be doing today. I'm providing some data around quality of services within the network. I have a team of staff who complete quality oversight activities with our providers. And so I have three staff that do those activities. And so we, handle the complaints, We also do the site visits out at group homes and day programs. We also, excuse me, examine case management files to make sure that the support plans and that they have everything that they need as far as the regulations are concerned. So that's kind of a little bit about what we do in quality assurance. And I'll turn it over to Heather.
Hi, thank you, Shelley. My name is Heather Pace. I'm covering today for Sherry Arbuckle, who is off in contract negotiations with KDADS right now. I am the service access manager, so I oversee access to services, so new people coming into the system, the application process, eligibility determination, as well as the staff who do the annual functional assessments. So that basis assessment that happens every year, I have 3 full-time staff who manage that process. We do have a staff who helps us out with complex cases and working with people who maybe have co-occurring behavioral disorders or mental health concerns, things like that, that kind of make things a little more difficult to try to figure out how to keep them safe and serve them in the community. I have a cohort named Becky, and Sherry oversees her as well, who manages the operations side of the CDDO. So looking and taking care of all of the data, the financial aspects of things, and ensuring that we're in compliance with the contract with KDADS. So like I said, Sherry is out at contract negotiations right now, but I will do my best to try to fill her shoes.
All right, and Al just joined us just in time
Howdy.
to introduce himself to our new board member, Kara Sumner.
Where?
You can just introduce yourself. Kara is here.
Okay, my name's Al Besser, retired military. I believe on my second term here as an advisory member of the board. Welcome.
All right.
And technologically challenged.
You know, if there's one thing we'll get from this pandemic, it is we're all going to improve our technology skills, I think. Just depends on what baseline you're starting at. So Carrie, I wanted to mention, as Heather mentioned, her staff is doing contract negotiations. So Sherry Arbuckle and actually Dee Niswanger, the director, are both doing contract negotiations with the Kansas Department on Aging and Disability Services, KDADS. So that's why Dee could not be here today, and that's why I'm kind of substituting for her. So I'll turn it over to Jim and let you start the meeting.
Okay, well, we'll go to the agenda at this point, and the first item on the agenda is to review the minutes of our previous meeting, which was Tuesday, February the 9th. And do we have any additions or corrections to those minutes?
Move to approve.
Second.
It's been moved and approved. Do we accept the minutes from Tuesday, February the 9th? All in favor, say aye.
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 Opposed? Same sign? The minutes approval carried. And then, second item on the agenda is the election of officers for the executive committee. And by our bylaws, the board is required to have an executive committee consisting of a chair, a vice chair, a treasurer, and 2 at-large members. And the voting to accept their nomination is to happen on our May meeting. And currently, the only nomination we have is Grace has gracefully accepted the nomination for chair, and we have no other nominations to report at this time. So right now, we would accept nominations for any other position you would like to be approved for from the rest of the board. I don't know if you've gone to the minutes or to the bylaws, but the chair obviously chairs, vice chair chairs the meeting in the absence of the chair. The treasurer is to become, well, with the financial part of this SCDDO, and Greg could probably enlighten us on that because I'm not aware of what all is involved.
It's very, very, very easy.
It all
We
is.
show up for meetings.
Yeah.
No math skills even involved,
No
was there,
math
Greg?
Again, no fingers and toes are all I need. And I do apologize, you know, I am trying to do some changes in my life and simplify, so I will have to step off the executive board. Hopefully somebody else can step in, but it really is just a matter of going and learning.
That speaks pretty well of all of the executive board. We just have a meeting 1 month prior to the complete board meeting, and we discuss anything that can't wait until the full board meets, and then we discuss the agenda, what's to be presented to the full board the next meeting. It's just 4 extra meetings a year. They last an hour. It takes very little of your time.
Jeanette, I am happy to serve. I don't know what the bylaws say about nominating, and I'm happy to serve in whatever capacity is needed. So.
Okay, well, there's, you know, like I said, there's 4 positions open, so you can whatever you want to volunteer for. We'd be happy.
But aren't they in the morning at, I'm looking here, 8 to 9?
Right.
Yeah. And see, I teach high school, so that knocks me out. Or I would do it.
I don't, like I said, I don't know if you can nominate yourself, but I'm happy to serve. And if, and like I said, whatever capacity is needed. For me, it's just a matter of making sure it gets on my calendar way before the meeting and I schedule around it. So.
Now, Grace, you had mentioned Joanna Kilgore was interested in a position as well.
Well, just on the executive board, but not necessarily an officer.
Okay, so maybe
And
one of the
since she's not
at-large.
here.
Yeah, I know she's not here.
I would be happy to be one of the at-large. I would love to be able to sit back and learn a little bit more, but be as helpful as I can.
Okay.
Okay, I'm just hurriedly taking notes here. So, well, okay, Carol would be one of the at-large. And Leah, you have no preference? Is that correct? I mean, you can nominate yourself, that's fine. We're just asking for volunteers.
And because I didn't know what position Grace was being nominated for, and I don't want to step on anybody's toes. So that's why I just said, it doesn't matter. I'll serve in however, whatever capacity is needed.
Can I suggest treasurer? Because that's the one that always intimidates everybody.
That's fine, as long as what Greg is saying is true, because I went to law school instead of medical school because I can't do math. So just,
You're good. You're good.
nobody expects that from me. I'll be fine.
So one more at-large member.
I'll nominate myself for at-large.
Al, all right,
Oh,
great.
great.
I think we have 3 at large. Don't we only need 2?
I'm going off of Dee's email. She said vice chair, treasurer, and 2 at-large members.
We also need a chair, don't we? Or is that with Grace's?
Grace is gracefully
Grace is
volunteered.
We
to
need
be
a
chair.
vice chair.
So we have an opening for chair,
Vice,
No, vice chair.
vice chair. So we need a vice chair. If Grace is going to be chair, we need a vice chair.
Mhm.
All right, sorry. Okay, yep, we need a vice chair.
Well, put me down for vice chair. If you're gonna learn, you might as well learn by fire.
And maybe, I wonder if we could leave the other at-large open and confirm with Joanna if that's her desire to participate with that. Can we do that?
Sounds as good as any. We can, yeah, we can always, we can always pick up an at-large, I think. Especially since Joanna said she'd be happy to serve. So,
Yeah, as long as we have the officers, it would seem to me that would be okay.
yeah, okay.
So Grace for chair, we've got Kara for vice president or vice chair, I've put VP. Leah for treasurer, Al for at-large, and then we'll confirm with Joanna before we elect her to the board.
Okay. Are there any other nominations at this time? Okay, it has been, do I hear a motion to accept these nominations for the executive board, the executive committee?
I also move, Jim.
Okay, thank you.
Second.
Okay, thank you. Been moved and seconded to accept these candidates. All in favor, say aye.
Aye.
Any opposed? Thank you very much. Okay, Jeanette, I believe that's the end of the agenda for us. Now it's your turn.
Okay, so Dee left me 3 pages of updates for her. So we have a lot to share with you. First and foremost, the Sedgwick County budget process is in play. We actually, the Department of Human Services or Department of Public Services, which the CDDO falls under along with health and ComCare and aging, actually presented to the county commission on Monday. So at our request is just a flat budget. The county doesn't fund a whole lot for the CDDO. Majority of our fundings comes from that contract that Dee and Sherry are negotiating with KDADS. But the county mill levies do fund our community service capacity and crisis plan, which is kind of partly our fallback plan in case there was an emergency. We have providers that are designated crisis providers, and they also offer services more rapidly, so a minimum of 7 days. So if somebody comes into services and due to crisis, so they're in crisis, they can select a crisis provider and attain services within 7 days versus other providers that have an average of 60 days to serve. So that's what the Sedgwick County budget covers. We went live with our new client record management system on the 6th. So that was Thursday. Sherry, Becky, Heather, and Carrie all did some heavy lifting getting that system in place. And we're really excited to have it in. So this is kind of the first phase of implementation. Eventually, we'll also have a client portal. So like your doctor's office probably has a portal. And then family and guardians and individuals could update their own information through that portal, and we could exchange forms and stuff securely through a portal. One of the processes right now with changing a provider, it requires a wet signature. So you could call and say, hey, I want to select this new provider. And then we'll say, okay, we will snail mail you a form to sign. And then you snail mail it back to us. And that's the process currently. That was a state requirement. We were doing it over the phone, but we're hoping the client portal will improve the processes like that. So move into the 21st century on that piece. So we're super excited about this new system, and it's called Metasked. And it was specifically designed for the IDD system, whereas our prior electronic health record was really designed for mental health. And we kind of had to shoehorn our system into that. So we're looking forward to this one fitting us a little bit better. As you know, we continue to negotiate our contract with KDADS. Some of the primary sticking points continue to be CDDO administration funding. They want us to do an awful lot of things, but they don't want to pay us what it takes to get that done. There have been some unfunded mandates that have come back down through policy that have added to our administrative burden that we're trying to address. And shifting interpretations of policies, that's been very cumbersome for us. Suddenly, they believe the policy says this, and so the CDDO is required to do that, and that's been a topic of concern. And just general communication issues and collaboration, particularly with changes in staff at the state level. An example of that is licensing. Previously, because we affiliate with the providers to provide the services. So there are affiliates, and we're doing that on behalf of our contract with the state. But licensing was having an issue with one of our agencies, and they didn't say, hey, by the way, we think you should know. Whereas we're always very good about letting them know if we have an issue with an agency. We'll even CC them on our contract compliance letters so that we feel collaboration with licensing is important. So things like that have been kind of made our jobs a little more difficult. So we are hoping with the contract negotiation process, this is an opportunity to bring these to light and resolve some of the communication and collaboration issues. Dee and Sherry are devoting today and tomorrow to it. Hopefully those will be the last days, because they started last month, and so it's a lot of work. So hopefully they work the issues out today and tomorrow, and we'll have a contract by July 1. Stop me if anyone has questions. An internal team here at the CDDO is working to implement. Vanessa's here. We have another new member. Hi, Vanessa.
Hey, Danette, I apologize for interrupting you in the middle of your meeting. I was doing a training. So thank you.
Wait, you want to introduce yourself real quick to everybody?
Oh, sure. Hi, everybody. I'm Vanessa Loaf. I'm a project specialist with the WSU Community Engagement Institute, and do training on all kinds of things for public health people. But I was a parent of a child with special needs and have been a longtime colleague that has worked with Jeanette and Dee, and I've known Dee most of my adult life. So thank you for letting me be here. It's good to see many of you that I already kind of know. So hi, Heather. Hi, Jeanette. Nice to see you all. And again, my apologies for coming in late.
All right, we have, actually, it's a total of 3 new board members that have been appointed recently. Vanessa, Kara, and then there's Jody Fiorini. She is, I believe, a professor at Wichita State University and is part of the work on the Autism Center that WSU is doing out there. Sorry, Dee instant messaged me. She wanted to make sure you got on, Peggy. Oops.
Sorry, my mic's off. Sorry. I emailed her and Carrie. I was like, I can't find it. It was in 3 emails back. Thank you.
Got it. All right. As I was mentioning, I was doing the updates from Dee. Internal team is working to implement Iris, which is this kind of new, really cool software. Originally, it was for maternal health organizations. So it was kind of like a centralized hub for referrals, but it's expanded out to just general human service organizations. And it's kind of the virtual equivalent of a warm handoff. So if you get somebody in your door that, you know, it's not right for your service, but really could get services from somebody else, rather than just sending them off with a name or somebody to call, you do the referral through this software, and that other organization agrees to reach out to the person and connect with them. So it's a way that feels much better than just hoping they call, particularly if they really need services. This is a way for them to better engage. So we're super excited about the possibilities of this program for our system. We've shared it with our case management organizations too, thinking that this would be really cool for them. So, and it actually, like I said, it started out through maternal health, and it's administered through the health department, and it's free. So any nonprofit can participate. And so they're growing their ranks. So it's a very cool system. Dee will be participating in an orientation session for the MHDD Echo Immersion Experience. It's an opportunity to replicate the MHDD, I'm assuming that's mental health, developmental disability approach taken by Alaska here in Kansas. Based on information gleaned from the orientation on the 7th, we will consider strategic partnerships to continue our work to close the gap in services for people with co-occurring IDD, mental health, and substance use needs. Heather, do you know anything about this model?
I do know a little bit about the model. It tends to be very collaborative with a lot of individuals being involved to really help support the system and navigate through multiple other systems that tend to be pretty siloed. So us, mental health, substance abuse. And so it's really wrapping the person and being able to respond to them immediately. The outcomes tend to reduce things like people, number one, bouncing in and out of hospitals, or people getting arrested when maybe they should be, you know, moved towards service provision instead of the correctional system. And so the outcomes that they've seen in Alaska are really looking very good. The curriculum that they have or the model that they follow is very interesting. So it'd be really cool to see how can we take the ideas and the concepts that they have and apply them in Kansas. So I'm very excited to see how it comes, but the outcomes are looking really good out of Alaska.
Very cool. So, and that's part of our strategic plan to try to address the gaps in services, particularly for those with co-occurring diagnoses, particularly IDD and mental health, or IDD and substance abuse. So very cool. And on a similar vein, plans continue to bring the sequential intercept model to Sedgwick County to look closely at the times and places individuals with IDD come in contact with the justice system. So this is a national model, and it's been done quite a bit, I think, with mental health and substance abuse to try to identify the points in time where they contact the system that maybe intervention can be done earlier before they end up in jail or end up in the hospital. This is the first time it's been done with an IDD population. And so, as Dee's prone to do, she's breaking ground, going where no other IDD system's gone, and we're super excited about it. The current model is administered through the Policy Resource Institute, and it's being adapted, like I said, specifically for the IDD population. Dee's been consulting with the PRI to adapt the model, and Sedgwick County will be the first in the country. And Kansas, the state of Kansas is very interested in this as well. So we're looking forward to implementing this. This will happen hopefully this summer, as long as they get the contract to me. I've got to probably send another email about that. Based on the work, we hope to collaborate on a statewide summit to further consider the implications of local findings to the state. So, like I said, stop me if you have questions. The SCDDO tech team continues working through the Disability Cocoon Shift certification training. So you'll remember our tech team is a group of, and Shelly, did I steal your thunder? Are you going to talk about tech team? Okay. Shelly and her staff took this over, and I just thought, oh no, that might have been on her updates. Is a group of several parents and guardians. There's an individual with a disability, and then there's a few agency representatives and some state advocates that are part of our tech team. And these are folks that we're going to kind of skill up and educate up on use of technology in the disability system. And so hopefully they'll become our champions, because you know, a few years ago, we specifically allocated some funds for some grants for agencies to adopt technology to improve independence of individuals and services, and also to help with the workforce crisis, kind of like a staff extender. But you know, there were no takers. I mean, it was like twisting arms trying to get agencies to take money to implement technology, and that surprised us. And a lot of that comes from, I think they're really busy, and I think that they don't know enough to know whether it's a good idea or not. There's a lot of maybe distrust on technology. So this core group of folks are going to learn more about that through this certification training. And then they're going to go out and help educate our providers. And they're actually part of the training is implementing technology. And so there'll be some grant funds for the actual team members to, all right, so you learned all about technology and how to assess a situation for the appropriate technology. Then they're going to actually get to go do that. And there'll be some grant dollars for those. And so they'll probably partner with agencies. So we're super excited about that. As I mentioned, our quality assurance team, since they're the ones that work a lot with the providers in the homes and day programs, they're the ones that are going to manage this. Originally, it was through a contract with Disability Cocoon, but that wasn't working so great. And so we have lots of confidence in our QA staff taking this over. I mentioned our strategic plan and one of our focuses. Our plan runs through this year. And so we'll be updating our strategic plan for 2022 to 2025, which sounds like a really long ways out, but it isn't. So we're in the process of developing a scope of work. We'll probably contract with WSU on that project like we have in the past. And so we always get stakeholder feedback as part of our process. So I bet you guys will probably be involved in that as well. So progress is being made on the direct support professional workforce crisis. Direct support professional, you'll hear that often abbreviated as DSP. So if I slip and I say DSP, I'm talking about the staff that works directly with clients to support them in the community. The CDDO, we published a white paper, and you can find that on our website to talk about the workforce crisis. And I will just add that current situation has combined between COVID and unemployment to make that workforce crisis just that much worse for agencies. Agencies are hurting right now, not being able to hire enough people to work as direct support professionals, which makes the project that Dee is working on all that more critical. And she's been collaborating with so many different partners to try to bring this about. Because, you know, we started in 2018 on this. We read about the OADSP. So it's Ohio Alliance for Direct Support Professionals organization. They were highlighted in a presidential report in 2017. They have a really cool program that is implemented in high schools. So juniors and seniors have a kind of like a career path. And so they get training and internships in those 2 years. And by the time they graduate from high school, they're certified and can go directly into a direct support position. And we have providers on board that would love to be internship sites for these high schoolers and would love to employ them once they're all fully trained. But to get this program working, Dee has been collaborating with the Ohio Association for Direct Support Professionals, OADSP, Wichita State University, Wichita Public Schools, Hayesville Public Schools has been in there as well, and the Kansas Department of Education, as well as the Board of Regents. It's required a lot of collaboration. Oh, Vanessa, cool. Vanessa was saying that she's on the Career and Technical Assistance Advisory Board. That is awesome. I'll let Dee know that. She will probably call you, Vanessa. Our long-term goals is we really want the Department of Labor to recognize the occupational code for direct support professionals. There's things that hinge off of that being a code, like CNA. Everyone knows what a CNA is, but not everyone knows what a DSP or a direct support professional is. And it's just becoming much more critical as the country ages, and so it needs to be recognized for the profession it is, and it needs to be paid for the skills that they bring to the table. Because right now, you can work at Walmart and make more than some of our direct support professionals. He's also working for industry recognized credentials in Kansas, developing a certificate of initial proficiency, certificate of advanced proficiency, and it's about professionalizing the field. A lot of agencies still are kind of old school. You get people that pass your background checks and they have a driver's license, and then we'll train you. But it is actually a very, clinical job. I mean, some of the things we require our direct support professionals, I would not feel comfortable doing. They have to work with feeding tubes. They have to work with lifts. They have to provide behavior supports for our individuals and services. It really should be recognized as a profession. And so those are all goals of that project. But in particular, trying to find a pipeline for students. So it's not that they necessarily are graduating high school right into a profession, but they could be going to college and be a direct support profession if they're interested in nursing, if they're interested in social services, all kinds of things, that this would be really good experience. So you've been hearing us talk about this for a long time, and we're really making progress on it. 2020 was a bad year for a lot of things, so we're super excited to get this back on track. So as part of that project, we're going to be taking steps in the 2021-22 academic year with a pilot project. Wichita State University will develop a badge course, which is kind of like their an abbreviated online course. It's through the College of Applied Studies, which used to be Department of Education, I think, at WSU. And actually, Dr. Jody Fiorini, who couldn't make it today, but she's one of our new advisory board members. She is in the College of Applied Studies. People that pass the badges will be offered college credit and be able to apply for learning opportunities with selected SCDDO service providers. So they can have an internship. So we're exposing more people to the field. And students will have assignments that will require experience at an agency, mentored by experienced mentoring staff. So that's really excited, because regardless of what profession they're going to go, if they're going to be a nurse, wouldn't it be great if they had experience working with the IDD population? If they're going to be a social worker, wouldn't it be great if they could go be a social worker that knows about the IDD population? So very excited about that. The badges will also be promoted to high school students, so they get earn concurrent credit. It's going to be one of the 4 established CTE pathways. So family and consumer science, teach and train, health education, and human services. So each of these 4 pathways requires students to take a family studies course, which we believe is where kind of these badges will fall in. During June, we have a teacher from North High School, Camille Wood Harding, and she will be spending time shadowing direct support professionals at ResCare, their residential program, Catholic Charities, which is a day program, Goodwill, which has day and employment services, and Rainbows United, which serves children. So she will then collaborate with Wichita Public Schools to create 2 weeks of course content covering the work of a direct support professional. And this will ensure that all students at Wichita Public Schools enrolling in the Family Studies course will be exposed to the direct support opportunity to serve. So we've got some real progress underway. Then Wichita State University and Wichita Public Schools will collaborate to present on a program at the July CTE conference, where all high schools will be educated on the content and the direct support professional string within these 4 CTE pathways, putting the potential program on the radar for high schools across Kansas. So Vanessa, I don't know if do you know what CTE stands for?
Career and Technical Education. That's the advisory board that I sit on, is for Family and Consumer Sciences. So I missed their most recent meeting. So I am super glad to hear that that's happening.
Well, you got updated.
I did.
All right. So, so that it'll offer high school students the opportunity to earn credit towards graduation by taking the Family Studies course, and concurrently college credit through the badge courses. And it'll also introduce them to local employers looking for direct support professionals. So we're super excited about this. If students turn 18 during their course of the badge education, our hope is that participating agencies will consider the possibility of hiring them, contingent on receipt of a diploma. So, and as they're really looking for folks right now, so that I'm sure that's a good bet. Badges will also be offered to current direct support professionals working in the field who wish to develop their skills. Our hope is that employers will consider rewarding direct support professionals or applicants with the certificates that they get from the badges by increasing wages. And I might mention, while speaking about wages, is that there is a rate increase that was passed in the governor's budget. They did an interesting thing. They made a rate increase retroactive to April 1st. So a 5% rate increase retroactive to April 1st. And then a new 7% rate increase July 1. And this is really pretty unprecedented. We went so many years without any rate increase. And I think, the legislature really recognized the impact that's had on our agencies. And this year, hopefully we'll make up for a little lost ground. So, like I said, stop me if you have any questions. For my report, I just wanted to mention that our state aid grants, currently we fund Rainbows and the ARC through our state aid grants. They are actually competitive grants that go out for bid every 3 years. And so it went out for bid this year, and we received total of 4 proposals. We have a committee, it's myself, Dee, and someone from another department, actually Brenda Gutierrez from Department on Corrections. We'll review those, score them, and make funding decisions on that. We're meeting Friday to do that. So when you come back to the next meeting, we'll get to tell you what was funded through those grants. So excited about that. The other thing I wanted to mention was a new program the state has developed. It's called STEPS. And if I were really smart, I would have looked up what that stood for before I told you about it. But it's something employment services, I'm sure. But it's a program that's specifically designed for individuals on SSI to help them gain employment. And it would pay for supports to help them achieve and maintain that job ongoing. Now, the pilot program is for 18 months, but the hope is if they can show good outcomes, it will be renewed. Because the current work programs like, is it Working Healthy, does not include SSI recipients. So a lot of folks on the wait list are not, can't access some of those work supports. But STEPS is specifically designed to help folks on SSI. So it's hoped that some of the folks on the wait list will qualify, folks that are looking for employment, but maybe just need some pre-vocational skill building, or those that might actually need an ongoing support to achieve employment. This program may be an opportunity for them to get services. Heather probably has an update on the wait list, but last I knew, we're just under 10 years for waiting for funding. So if there's any hope for some folks that are on that wait list to maybe gain employment and maybe reduce the need for services ongoing, we're super excited about that. So not to mention, hopefully it will be a funding source for the adult project search, because we're assuming that would qualify under pre-vocational training. So it's a program that begins July 1, steps. So be looking for more information on that. Heather, I think you're next. Did you want to go from there?
Sure. Mine's short and sweet. We've spent most of our time this first quarter here of the year working on implementing that new software system that we have for our electronic medical record. That's been a huge lift, trying to take all those old records and move them into a new system. So it just went live. And of course, with any computer change, there's always a few bumps in the road that we're working our way through right now together. But so far, nothing horrible. So that's really good to report. We did start getting waiting list allocation money about a month ago from KDADS. So far, locally here in Sedgwick County, we had 29 people who were offered waiting list funds. Of those, 18 people accepted. One person declined the waiting list funds, but wanted to be added back to the waiting list. They're just not quite ready to utilize that yet. We did have 9 people that did not respond to the waiting list offers. And then we did have 1 person who accepted, but when we did that basis assessment, they were not eligible for the waiver funding. They scored a tier 0. So that's where we are with the waiting list numbers right now. I did pull up our CDDO monthly report, and currently we still have 2,600 people here locally that are eligible for funding. We keep adding somewhere around 30 or 40 people per quarter to our service system and to the waiting list. So we continue to grow and move forward number-wise with that. And just if anybody doesn't know, if we do have people that either decline or they don't respond to those waiting list offers, KDADS then goes back down the statewide list offers again until they utilize all of the waiting list money with people that accept. So we anticipate probably getting more people that get offers based upon statewide people who don't respond or decline the waiting list funding. So that's where we sit currently. Is there any questions about any of that? All right.
I had a question for you.
Yes.
Could you talk a little bit? So we follow, can you talk about the process that we use? When KDADS notifies us that some of folks in our area get an offer, we send that to case managers, and we also follow up with the people. You might just kind of explain that process a little bit, because we don't want anyone to miss out.
Oh, right. Absolutely. We absolutely don't want people to miss out. So when we get the list, we get a presumptive list from KDADS before they actually make the offers. And so we know the names of the people that they're looking at. So we go through that list to make sure that we have the most current up-to-date information that we possibly could have. And then the waiting list offers actually come out. KDADS notifies us that the offers have been made, who they were made to, and we jump immediately getting the case manager engaged as well if they have a case manager. Unfortunately, with the waiting list being 10 years long, if somebody doesn't have a case manager, they could have moved, they could have changed their phone number, they didn't keep us updated with that information. And so tracking them down can be very difficult. So what we do is if we have somebody who's not responding, that KDADS notifies us then that they haven't heard from, such and such person. And so our operations department kicks into gear and starts going down any phone number we have, any other contact person that they've listed in that person's life, trying to track them down. Where are they and what's going on? We'll send letters. If somebody's responded, they say, yes, I want waiting list funding. The next step is that we have to do that basis assessment to ensure that they're still eligible, if they still reach one of those tiers when we do the assessment. And sometimes we they'll say, yes, they want the funding, but then we're reaching out to schedule the assessment and they don't return our calls all of a sudden. So at that point, we start reaching out with certified mail, doing everything we can to try to engage them, because we really want people to accept those funds and not miss out just because they moved and forgot to call us and tell us their new address. So we do a lot of work to try to find those people and catch them. Unfortunately, 10 years ago, I couldn't tell you what my phone number was. And the mail's probably not being forwarded anymore from my old address from 10 years ago. So it gets really difficult trying to track people down sometimes. So we continue to try to work on that and stay engaged with people, year to year, sending out their annual rights and stuff, following up if we get any mail returned, to make sure that we try to keep as much current information in the system as absolutely possible as we move forward. But there is quite a process that we go through, really trying to track people down when those waiting list offers are coming out.
Thank you. Any other questions for Heather? I'll give it to Shelley.
I had to find the mute there. Jeanette, do you have sharing capabilities for me? So one of my responsibilities is to deliver the Quality Assurance Committee quarterly outcomes. At our last meeting, I presented information about the entire year of 2020. Due to COVID, things looked so different. But we were able to get back into what we would consider the more normal process of evaluating an individual's services, and that's through the Quality Assurance Committee process. And so since we have so many new members, I thought it would be helpful to share one of our workflows that describes not only the monitoring team's role of the Quality Assurance Committee process, but your role as advisory board member. So let me.
You have capabilities to share screen, Shelley?
Yes, I do. I just couldn't find the document. It wasn't showing it to me. So, okay.
I was trying to make you a co-host. I couldn't figure that out, so.
Okay, no problem. Well, what you all should see on your screen, and let me blow this up. And this is something that we have shared in the past. It's probably in your advisory board book that was provided to you when you became a member. But we do send this out periodically, but I don't believe that this specific workflow was included in the materials that were sent out today or for today's meeting. But this kind of gives you an overview of the Quality Assurance Committee process. There are lots of players in that process. And so trying to get it to a place where it's not so big, but not so little. So let me scroll down a little bit. So our targeted case management providers are our centralized group of agencies that begin the Quality Assurance Committee process. So as you can see there right here in this green box, so they are the ones that establish all the monitoring teams. These teams are include individuals who receive services, family members, guardians, anybody that's interested in participating in their monitoring team. These are not paid staff by the TCM organization. So they are allowed, I guess, to have one team member who is a paid employee of their organization, but all their other members are supposed to fall into these other categories. And so what these teams do is that they go out and do reviews of the services for the individuals that were selected for the Quality Assurance Committee review. The way that we select those individuals, it's by a randomized selection process. We do 10% of the population of individuals who have targeted case management plus one other service. So as you can imagine, there's a variety of services that are available and offered to individuals. And so sometimes these monitoring teams will be going out to group homes. They may only go to a day program site, or they may be going actually to a family home to talk to staff and to see the environment and complete a person-centered interview. And all of these processes are in standardized tools that our teams utilize to make sure that they're evaluating it as consistently as possible within the context of the QAC process. So once our teams go out and complete all of those reviews, I'm going to scroll down to the bottom of the page. What they do is that they give it back to the CDDO. So Jamie Kite, she is our QA coordinator. She oversees day and residential services at the CDDO. And so she reviews all of the documentation and all of the interview tools, and she completes a scoring sheet. So this is where it gets really technical. There are approximately, well, I could tell you for sure, there's over 600 different areas that can be evaluated in a person's services. And this is all based on the scoring guidelines and how we set up the QAC process. So she scores all the reviews. We send all of the data back to our providers. So not only does the TCM organization receive the information about the reviews that they completed, but the individual organizations, the day programs, the residential providers, the self-directed staff, they all get this information back. What you guys get to see is kind of the network overview of services. And so you guys are down here in this orange box as the advisory board committee. Quarterly, you'll review the data, and I will provide you information about the quality assurance quarterly meeting that we have with our providers. They're the ones that examine the high level details, and they provide some information, or they focus areas on what they would like to do about the outcomes of the review. So so did that change on your screen? Are you guys now seeing?
Mm-hmm.
Okay.
Yeah.
Technology is my friend today. So you guys did get a copy of this. Carrie sent this out, I believe, yesterday. So this is the outcomes of the first quarter of 2021. So that's January, February, and March of this year. And what I've done is, I'm not going to read this to you, but just to highlight some notable areas. So when we look at the outcomes of QAC, we're looking at scores that are at a 1.5 or lower. And so when we think about a 2-point rating scale, 1.5 is kind of where we've determined that there's concerns within the service area. So as you will see, I highlighted 1.25. So we have, the scores are broken down into different areas. So for example, there's a rights, dignity area. Does a person have choice? Does the person feel safe? Does the person, receive the services that they are supposed to be getting? Do they have choice? Does staff know how to report abuse, neglect, or exploitation? So as you can see, these are kind of some headings at the top of the scoring area. So 1.25 is the behavior section. This is revolving around, does the plan have appropriate documentation around any restrictive interventions that are being used to manage or to support a person in their services? Are they being restricted without consent? Is the family taking things away from the individual when without, I guess, the right ability to permissions to do that? So for example, if you're an adult in services, the provider can't tell an individual, well, you can't leave the home. Because we all have the ability to leave our homes whenever we choose to. However, there are some individuals where when they leave their homes, there is risk because either they don't have the ability to make good decisions. They physically can't go out into the community on their own because they need the staff supports, or they need someone to help them navigate the transportation. So those are the kinds of things that we're looking at when we're looking at behavior, kind of that behavior section. So let me scroll down. Some of the notable areas, as you can see, the behavior section, which was low, is under self-direction. So this is personal care services self-direction. So these are individuals who are self-directing their services, meaning that either them or their guardian is the employer of record. So you will also hear this called FMS, or financial management services. These are services that are provided in the home by a paid caregiver. Sometimes those caregivers are family members, neighbors. Right now, due to COVID, guardians do have an exception to be a paid caregiver for their wards. So that's kind of the population of staff that we are focusing on within this particular service. So as you can see, it is the lowest score at a 1.25. There were 12 workers who were interviewed, and 5 of those workers were the ones that had the deficiencies. So 5 out of the 12 services that were self-directed, those staff members or those family members, more likely, they had a deficiency within the packet or within the QAC review itself. And so interestingly, one of the data elements that we look at is staff longevity, not only with the person, but also within the organization that we work with or that they work with. And so as you can see, out of those 5 workers, they have worked with the individual on average of 11 years. So we can make some assumptions that the people that were supporting these 5 individuals know them and have known them for a really long time. But then we also think about, well, why were there deficiencies within the behavior section? Many of those deficiencies would look like things like, does the person that you support have a behavior support plan? Maybe they would say yes, and they didn't have one, or they would say no, and they do have one. Or the deficiencies could be something like, can you tell me about any behaviors that they exhibit? And they say, oh, well, they don't have any behaviors at all. I don't have to manage any aggressive or maladaptive behaviors, but the support plan, it clearly talks about maybe physical aggression, or maybe needing assistance to complete certain types of activities, or maybe we see a lot of individuals, especially autistic, where they have trouble being in large crowds. And so sometimes that creates some anxiety on their end. And so staff have to make sure that they're supporting them in a way that doesn't get escalated, maybe managing the large number of crowds that they're around. And so what the QAC committee talked about at our last meeting is kind of where the experiment section is. So before COVID happened, we were working hard on our self-directed services. Some of the experiments that had been tried, or we were trying to get implemented, is to helping our families that are self-directing prepare for these reviews by providing them resources and education prior to the monitoring teams coming out to the home to complete the interviews with them. And so, as you can imagine, because of COVID, many people stopped having services because people were coming into their homes. And so what we brought those experiments back to this group. And we have a couple of our organizations who have committed to creating an experiment around pre-education before these, I guess, monitoring opportunities are happening by sending out the interview tools and actually having intentional conversations with the staff that do provide supports to these individuals who are self-directing around the context of the Quality Assurance Committee, I guess, interview and the process and kind of why this is happening and what's the purpose of these reviews. And so it feels like that we have, taken a big step back about a year and a half to really focus again on our self-directed population. If one of the things I kind of skipped over here is this top section where it gives you a breakdown of the services that were reviewed. So there were a total of 38 individuals who had their services reviewed this past quarter. And out of that 38, 12 of them were the ones that had self-direction as a service area. And so again, when you look at numbers, it's 12 individuals who had the service. 5 of the staff of those 12 had some deficiencies around self-direction. So that's kind of a long explanation of QAC, but I wanted to provide kind of some background and context for some of our new members. Because QAC just kind of got reenacted after COVID, we do not have any agencies on intervention plans. Intervention plans are requested when we see a trend of deficient scores within our service areas. And so we do not have any providers on intervention plans at this time because of us just reenacting that. But scores do look really good for the quarter. To kind of give you a perspective, I was telling you all the service areas. This little section right here, it talks about there's 665 possible areas of deficiencies for these packets. And so when we look at the number of deficiencies, there were 71 in total. A person can have one deficiency. It's not really the person, it's the person's services. There could be one deficiency for an individual and there could be 25 deficiencies. Just really depends on the packet and the review and the interview tool. So when we drill it down to total possible, it was 11% deficient, which by no means is a concern. And again, we just try to break it down a little bit more into a little bit more details to actually go into specific areas of the reviews to drill down a little bit more to figure out what are the highlights, what are the issues. So that's Quality Assurance Committee. Again, it's a lot of information, but I do want to kind of stop and see if anybody has any questions. All right, well, I'm going to take your silence as no questions, certainly understand. I do just want to-
I'm sorry, Shelley, before you go any further.
Sure.
I was just going to say, so like self-directed, the individual or their guardian is the employer, meaning that they hire and they are responsible for training and scheduling the staff.
Correct.
So and typically they obviously select somebody that's known the individual very well. So right. It's interesting that of all the services, that one came. So.
Yeah, absolutely. And, we've had lots of conversations about self-direction. And I think that, when I'm just kind of going to take my own family, when you talk about, tell me about your child, sometimes we don't focus on the things that they need. We focus on the things that they can do. And so sometimes these reviews, it's about checking to make sure staff know and understand and know what the person needs according to their support plan. And so sometimes we identify that support plans lack details, or we've done these reviews before where we learn that there are special meal modifications that the staff or their family members do for their eating. But the support plan doesn't talk about that because it didn't come up in the planning meeting. The other service area may not know about it. So we do, I think it's a way for the families and the case managers and the other services to make sure that what the person's support plan says, that they're actually getting what they need. If there's something missing, then we help the case manager get that into their plan. So, again, when we look at the raw numbers, 11% deficiencies by no means is a concern at all. So, yeah. Let me see. So I wanted to just share a couple of updates with the quality assurance team. Jeanette did talk about the tech team. So all of our QA staff, we are also participating in that. It's called SHIFT, is the training curriculum, and we will become technology navigators, I believe is the term. And so we will also be trained on how to utilize the SHIFT curriculum to not only examine whether technology is something that a person is interested in, but also helping families or helping the individual determine the correct implementation of that technology. There's also a whole other section about how do we help providers examine their policies? How do we help providers demonstrate within the ISP with the integrated service plan? That's the allocation piece of a person's services. How can we demonstrate that the use of technology actually helps repurpose staff, not get rid of staff, not minimize the number of staff that are needed to support individuals, but to repurpose them to whether it's with other people that need that additional support or within the organization itself. So super interesting curriculum. I believe that we're working on a charter for this group as well as a plan of work. So lots of work to do, but exciting. Also, just wanted to let everyone know all of our day program providers are open. So people are getting back into services, which is really great to hear. We did the vaccine clinics and now that the vaccines are available to everyone in our community, and now we're starting to get into the adolescent population. This is really great news for not only our providers, but also for Rainbows United, who serves 18 and under. So it's really great news. Wanted to also let you all know that we are getting back into the field. Our case management file reviews are starting to be administered back in our locations, in our service locations. So we are back out in the community where we have not started getting back into the group home settings, but that I'm sure will be coming within the next few weeks. And so pretty much everybody in QA is back to business as far as out in the community, seeing people, going out to service sites. So that's really great news. And staff really they're excited to leave their homes to do their work. So that's really great to hear that they're excited about getting out into the field and seeing our consumers and talking to our providers face to face. So, and that is it for QA. If anybody wanted to kind of stop again and see if anybody had any questions about quality assurance or anything that I shared today.
So I thought maybe I'd just clarify a little bit since we got a couple of new board members. So there's the QAC process, which does the 10% sample. And then your staff, you have a couple of different staff that go out, plus your TCM coordinator that does the file reviews. So there's kind of two levels of quality assurance going on. So we work really hard to make sure our networks providing services in the way they're supposed to.
That's right. All right. Well, thank you, everyone.
That's it from us, Jim.
Okay, well, thank you, everyone. Before we adjourn, I just wanted to welcome all of our new members. Glad to have you aboard, and thank you for agreeing to be on the executive or on the board. And really, I'd like to thank Grace and Leah and Kara and Al for agreeing to serve on the executive committee. And thank you, Greg, for serving for so many years.
Yes.
Now, if there's no additional or new business, I would accept a motion to adjourn.
So move.
Second.
Moved and seconded, we adjourn. All in favor? Aye.
Aye.
Opposed? We are adjourned. Thank you very much.
Thanks, Jim.
Jim,
Yes.
Kara, I just have a really quick question. I never received any booklet, or I did my oath and documentation for the board, but was I supposed to be getting anything specifically from the county?
We do have a manual, and Vanessa, have you gotten one yet? No. Okay. So I know one of the projects I think we were working on was making it electronic, so I think it could be emailed. I don't know that it's been electronified or whatever you want to call it yet. So we'll make sure all the new folks get the actual manual. So sorry about that.
Okay. No, that's okay. I thought, okay, have I really forgotten with online school? Has there been something come in and I've forgotten it completely?
Yeah, you know, in the good old days when you actually went to the county commission meeting and got sworn in, we would meet you at the door with the book and or schedule a meeting with you to sit down with the book. But everything's remote now, so.
Well, thank you. Thank you for letting me join, and I'm excited. So thanks so much.
Thank you, guys.
Bye, everyone. See you next time.